My goodness, it was 4 years ago when the main message from us almost every night was, don't panic. And that's because the new coronavirus had been detected in our state for the very first time.
Of course, the effects of the pandemic still felt. Today, 4 investigator Ryan Laughlin shows us how.
People were definitely freaking out.
If we didn't experience it together,
it was a pretty crazy time.
It'd almost be hard to believe.
People were sneaking through back doors to my hairdresser, who shall remain nameless.
I bought those collapsible sanitizer boxes, and I don't think it worked.
It's none of my business what you do, but then people were like, did you go out? Did you go to a concert? Did you go to the bar?
4 years since the first COVID case in New Mexico.
I think from a public standpoint, it was very polarizing.
What have we learned?
I think the hard part was we knew nothing about the virus.
March 11th, 2020.
During that press conference, you were behind the right shoulder of the governor. At that moment in time, what's going through your head?
The degree to which we were dealing with something that was A, huge, and B, unknown. So I felt apprehensive.
Dr. David Scrase became known to millions as the doctor who would lead New Mexico through the pandemic.
People were initially afraid, and then they were angry. And I felt like I was serving a useful purpose to the people of New Mexico by being a repository for their anger. Because I realized it wasn't about me, even though the emails kind of were about me. This isn't about me. This is a really hard situation. These people have never heard of a pandemic or been through one.
Do you think we made all the right steps looking back?
Using the word right or wrong doesn't actually apply, because what we were doing is taking some fairly weak evidence, particularly early on, and just making the best decision we could. If I could go back, I think the one thing I would do differently is not recommend that people wear masks outside. And I think that one's on me.
While CDC data shows New Mexicans died of COVID at higher rates than most other states, Dr. Scrase says that's not the whole story, given New Mexico's poverty and health challenges.
By and large, we're the first state to get a robust testing system up and going, which made all the difference in the world. We're the first state to reach 50% vaccination rate in the country. While all other states had vaccination rates for lower income people that were half of the vaccination rates for higher income people, it was equal in New Mexico. And the question that I feel good about is, did we save more lives than we would have expected?
However, COVID is not over.
What other ripple effects do you see still making an impact on healthcare today?
I think one of the things that we're still seeing is the change in access to care around the state.
UNMH CEO Kate Becker and Chief Medical Officer Dr. Steve McLaughlin see it similarly.
A lot of rural communities either lost their providers or lost their nurses or weren't able to provide services, and they still haven't really come back.
That means that those individuals have to find some place for care. So they can go out of state. That's not feasible for a lot of people, actually. So they end up coming to the larger metro areas.
New Mexico's largest hospital operates under pressure.
Before COVID, this hospital ran 110% maybe of its capacity. During COVID, we got up to 150% of our capacity. Turned every space you can imagine into clinical space of some kind. And even now, post-COVID, we run between 120 and 130%.
Space is one thing. Retaining healthcare workers after the pandemic is another.
There has been a lot of burnout.
4 Investigates found UNMH data showing resilience among staff, doctors, and nurses is down a lot since the onset of COVID. And the hospital's well-being team is trying to keep healthcare workers happy.
That has been a shift, I think, in healthcare in general, and certainly in this institution, I think, over the past 5 to 10 years.
The promise of change is coming into view.
I actually feel like we're in a really pivotal moment.
The new UNMH tower is supposed to open next year, easing capacity concerns. And the governor just signed a law directing more than $1 billion to rural hospitals.
It really is going to be transformational.
The loss of life cannot be overstated. COVID changed us.
Well, I was stuck in an abusive relationship.
We changed relationships. We changed ourselves.
I was actually an alcoholic and actually came out of COVID sober.
Now we all look to what changes next.
Now we're trying to get back to normal, you know?
We covered a lot of ground with Dr. Scrace. If you're interested in what he had to say about vaccines and vaccine hesitancy and a whole lot more, we've put the full interview under this story on KOB.com. I'm Ryan Laughlin for Investigates.